Hi, I'm Dr. Dick Walker, and I'm coming to you from Spokane, Washington, and I'd like to talk a little bit about ASEA today. I also am a nutritionist and a specialist in preventive medicine, in addition to being an emergency physician, and I just love ASEA because there is no other technology that will help your body to fix and repair itself at that cellular level, which is the foundation for every kind of problem that we have. And I have been super impressed with what these molecules can accomplish. I was first introduced to this 5 years ago, and I was a little bit skeptical about some of the stories that I heard and some of the claims that were being made. And so, a week after I first heard about ASEA, I was down at the headquarters talking to the scientific team, and I came away very, very impressed with the science behind this. But I still wanted to see, would these molecules do what I thought they would do? And so I started recommending them to people. And I started to see conditions that were not amenable to anything else that I had available. No nutritional product, no medicine, no procedure. People that come back to the ER, back to doctors' offices month after month after month with the same problem. And yet these people would get on this product, and within weeks to months, they would have breakthrough experiences. Their health would improve exponentially simply by drinking a mixture of redox signaling molecules. That did two things to me. Number one, it blew me away because I've never seen a supplement that can do anything close to what ASEA was doing for these people. And number two, it gave me a much bigger appreciation for our body's ability to fix and repair itself. Because we talk about that in medical science, and yet many of us don't really truly understand the degree to which your body can fix damaged cells, can fix damaged tissue, can restore function to tissues that are not working the way they should be working. And it's just been a real eye-opener to me as a medical scientist who's pretty hardcore about what I'll recommend and what I won't recommend. If I don't think something is worthy of it, I'm not going to tell anybody else about it because that's my reputation, and that's me. And I've been super, super impressed with what ASEA can do, and I really trust this product that when I start somebody on this product, they are going to see results within 3 to 4 months.
Dr. Walker, what are the results that you noticed yourself when drinking ASEA?
That's interesting. Because at first I didn't really think anything was happening. But I started on these molecules in October, and I'm an avid skier, but I was 65 years old, and I had gotten to the point where I couldn't ski more than a day or two in a row, and I'd have to take a day off because my body was sore and tired, and it just wasn't fun to ski more days in a row. Well, I went up to the mountain after being on ASEA for about, I think it was 6 weeks or so maybe. And I went up and I skied 1 day, I felt fine. I skied 2 days, I felt fine. I ended up skiing 6 days in a row. Still felt fine. The only reason I came home was because I had to work a night shift in the ER that night. And I remember telling Nancy that now I understand what they mean about ASEA helping us older bodies to function like we're much younger, because I just didn't think I'd ever be able to ski like that again, and yet it was there. And then the results of ASEA are not always quick. And what happened to me is also on the long-term front is that I've had a blood pressure issue for over 30 years. I was on 4 maximum doses of 4 different medicines to control that blood pressure. Now, I don't know exactly how much influence ASEA had on it, but I'm not on any of those 4 medications anymore. And I have very normal blood pressure. And so I'm quite happy about what ASEA has done for my long-term health. I know that my body may be 70 years old, but it's not functioning like a 70-year-old body. I'm doing things that I hadn't been able to do, and I trust that I'll be able to continue to do those for many years forward. So ASEA is just a wonderful, wonderful product. And it works. You don't have to be 70 years old to appreciate the benefits. We just did a genetic study with a company called Torrey Labs, and the cohort, the group that was studied, was young adults, average age 35 years old, and yet we were able to show that by taking ASEA, there were 5 major genetic signaling pathways that were improved by up to 32%. And these pathways involved things like blood sugar issues, thyroid hormone issues, hormone modulation, antioxidant production, arterial elasticity. And when I saw that it affected arterial elasticity, I thought, that just may be the reason why I'm not on high blood pressure medicine anymore, because I don't have hardening of the arteries. I have normal blood pressure. Wow. And so it's done some wonderful things for me, for my wife, for my grandchild. I mean, I could go on and on about the experiences that have happened in people who are close to me and that I really care about.
Dr. Walker, tell us what it did for your wife.
Well, my wife was, you've got to kind of know, my wife and I have climbed rock climbing, mountain climbing, really all over the West. And so we were really, really active. We played hard. We enjoyed that. But Nancy came down with a condition where her joints were achy, her muscles were achy. It was a real challenge for her to get out and enjoy those things that we had become so, enamored of. And she also had a fatigue issue where literally she could sleep for 12 hours, wake up and take a nap an hour later. She'd sometimes fall asleep on the way home from school after she picked up the kids. She'd pull over into a parking lot, take a nap. I mean, it was terrible. And nothing that I had been able to recommend as a physician or a nutritionist or anything had really made a big difference for her until ASEA came along. And for the first 6 months, ASEA didn't seem to be doing much for Nancy as well until we sat down with Gary Samuelson, the medical atomic physicist who was largely responsible for stabilizing these molecules, and said, hey, what's up? She'd been taking 8 ounces a day for 6 months and she hadn't noticed much change. And he said, here's what I want you to do. I want you to take 8 ounces twice a day. And within a couple of weeks, Nancy's condition had pretty much resolved. She may have a minor flare and she just bumps her ASEA back up. And so it's really made a huge change in her life. And we're back to doing stuff that we hadn't done for years. So it's a great product.
Dr. Walker, people always ask, will it help with this? Will it help with that? What would your recommendation be?
Well, it has the potential to help with anything that involves cells, and everything in your body involves cells. And so, yes, I just say, the only way you're going to know how much is going to help you is to try it. And chances are that it's going to help you a great deal. But everything in your body is cellular based. All of your organs are made of cells. Everything depends on having healthy, functional cells and the ability to repair and replace those that are damaged. And that's what ASEA does. And so it doesn't matter where the damage is or where the injury is. Your body knows where to focus these molecules and how to get the job done.